It's those little things in life that bring so much joy to me, but I've had all this joy taken away. My whole world is nothing but severe joint pain, stopping me in my tracks. I feel like nothing but a letdown and as if I'm missing out on those little things in life. I just look out into the world with a heavy heart and hurting joints. I want to experience life again.
Hi, how are you?
Good.
Alright, what's the problem today?
I've been having issues in my joints. It's really hurting to do a lot of different things.
Alright, so what if we prescribe this drug? It's called methotrexate. It'll just help reduce the inflammation in your joints to help reduce the pain.
That sounds great.
Alright, so would you rather take it orally or would you rather give yourself injections?
Oh, I'd rather take it orally.
Alright, so first we're going to start off with a dose of 2.5 milligrams twice a day. We'll do 3 days, and that's going to help reduce the accumulation of getting a resistance to it. So is that alright?
Yeah, that's fine.
Alright, so here's this pamphlet about it. So here's just some information about it. So when you take this, you want to start keeping a calendar to keep track of your doses, so that way you make sure you know what days you're taking it. Alright, and then also you want to avoid alcohol use while you're taking this.
Okay.
And you also want to use sunblock so that way you don't get sunburn when you have sun exposure. And then you also need to contact us if you have like any bruising, chills, cough, dark urine, fever, mouth sores, shortness of breath, sore throat, and then yellowing of the skin or eyes.
Okay.
And then also you want to make sure that you're using effective birth control because you do not want to get pregnant on this.
Okay. All right.
Alright, sounds good?
Yeah, that sounds great. Thank you very much.
You're welcome.
My name's Kimberly Sizemore. I'm here to pick up my medication.
All right, Miss Sizemore, I have you for methotrexate. Is that correct?
Yes, that is. This is a new medication. I haven't taken it before.
Yes,
What
okay.
can it do?
Let me give you the drug guide. And so in the drug guide, we have listed here the side effects. So watch for an upset stomach, loss of appetite, a sore throat, bone marrow suppression, and low blood cell count. Also, liver and lung damage can occur. And I want you to report to your doctor if you're experiencing a fever, infection, swollen lymph nodes, or if you're experiencing bruising or bleeding of any sort.
Okay.
Now, when you're on this medication, I want you to be cautious of fatigue.
Okay.
So don't, drive or anything if you're feeling tired. And then also, women should not become pregnant when on this medication.
Oh, okay.
Okay. And don't drink alcohol for liver failure.
Okay.
And then also, you're going to take this medication by mouth once a week.
All right.
And then you may also need to take folic acid, 1 milligram per day, to help with the bone marrow suppression.
Okay.
Okay.
Well, thank you very
All
much.
right.
Methotrexate treats severe rheumatoid arthritis by suppressing the body's immune response. This can also be used to treat severe psoriasis and polyarticular juvenile idiopathic arthritis. Don't take this medication if you have hypersensitivity to it and are pregnant, plan to become pregnant, or are breastfeeding. Don't take with other medications such as NSAIDs, penicillins, oral anticoagulants, proton pump inhibitors, and sulfonamides. These increase the risk of liver toxicity, bleeding, easy bruising, and methotrexate toxicity. Don't drink alcohol to avoid liver damage with this drug. Use sunblock in the sun to avoid the risk of skin rash or irritation when on this drug. If you or a loved one is experiencing rheumatoid arthritis pain that's unresponsive to other therapy, ask your doctor about methotrexate. It's those little things in life.
Life is a beautiful thing, and now with methotrexate, I can enjoy the beauty. I can finally enjoy those little things in life without pain getting in my way.